All right, there it is. This is my my little blister simulator. Somehow I just could not get anybody to volunteer getting a blister form for me so that I could do this for real. So we've got a couple of blisters here that we're going to be able to talk about. These two right here represent the small blister formation that is not really causing any pain. It's gone beyond the level of a hot spot and has formed a small fluid collection, but it's not one of these big floppy blisters, which we'll talk about later. Also, the important thing is the overlying skin is intact. So we're going to treat these basically by isolating them. Now, this is a great application for the Spenco second skin, and here's the package, and this is what it looks like in the store. These usually come about 5 pads per box. They're a little bit on the spendy side, but trust me, that Spenco second skin is very soothing and cushioning, and when you're out in the field and you've got a blister and it's rubbing on your heel or the ball of your foot or one of your toes, you're going to say, I don't care about spending that extra money. So this is a great little thing to have for your blister kit as well as in your level 2 first aid kit, because when you get back to camp or maybe in your car and you're on a day hike, now you've got some capabilities for changing that dressing or treating somebody else. So these just basically open up, let's find the peel top, and you've got a small area that you're going to remove the dressing or the backer. There it is. And you basically apply that second skin center right over the blister. So we're going to treat this one here. You basically just apply that, try and center it. And then just remove that little finger tab, and that'll cushion that blister and take care of it. This would represent a blister that has also formed a little fluid collection, but it's not an area that's continuing to rub. And just a reminder that that type of blister probably doesn't need to do anything other than just kind of keep an eye on it. But you might progress to this level. We're trying to prevent it from going to that level. This blister here, you're going to want to take your alcohol pad and wipe this area, which will certainly take care of any bacteria, but it will also dry the skin a little bit and make it easier for your dressing to stick. You can also wipe the tip of the safety pin with the alcohol pad. If I were to do that, the first thing I would do is wipe the safety pin, lay that aside where it's going to be clean, and then clean the blister. Now what you're going to want to do is use this safety pin to puncture the blister, and the best place to puncture a blister is wherever it's dependent. So if this is like on a heel, I'm going to want to puncture it at about the 6 o'clock position, and the reason for that is that's going to allow it to drain the fluid and not make a reservoir that it's going to fill up again. So if you punctured it on the top, it could fill up again, and what we want it to do is to continually drain. And all you do is very gently at the 6 o'clock position, you're going to just make a small puncture into the blister itself, just like that. So I'm in the blister. Try not to hit the bottom of the blister, the base of it, because it's going to be very tender. And then you pull this out. And now I'm going to just gently use this little gauze here. I'm going to just gently, you'll see that the fluid is coming out. So you just gently express that fluid and get all the fluid out of the blister. And you just do it gently. Okay, so now we've punctured the blister. We've gently drained the fluid out. If you wanted to, you could take your alcohol pad again and just gently clean that area so that it's nice and dry. And now we're going to make a MoleSkin donut with an isolating cover. You could, if it was a small enough blister, again use one of these Spenco pads, but I want to take advantage of showing another method here. I'm going to pause the camera, make the donut, and then we'll pick that up in a minute. Let me just show you where I'm at with making this donut. So again, remember we talked about making it perhaps a ½ an inch or a little bit more wider than the blister is tall, and perhaps an inch longer than it is long. It's very important to round the corners on these donuts, and that is because if you have a sharp corner and it's rubbing in your sock, that's going to want to pick up and start peeling this back, and now you've got a folded layer of MoleSkin that now is going to cause another blister rubbing area. So it's very important to round these corners. You could take your razor blade and just make 45-degree cuts as well, or if you've got your scissors, just round them. It's not a problem. Now the way you make the donut, and this is going to be a bigger donut, but this is how you start it, is you fold it in half and then you just make a little diamond cut, which allows you to get in there with your scissors and now just cut a circular donut hole out of the center of your bandage. Now what I'm going to do now is I'm going to just peel this off and apply this donut. Remember, the whole purpose of this donut is to isolate this blister, so raise the dressing up a little bit. So remember, we've cleaned, we've drained. Now we're going to apply this donut to the outside of the blister. And then we're going to take a piece of the cover dressing, which is another MoleSkin product, and it is just a very thin, cushioned, adhesive bandage. Okay, we're just going to peel off the backer and apply that to the top of this donut dressing. Now you can do one of two things. You can make it fit the donut dressing, or you can let it ride a little bit wider and kind of ramp out off the edge of the dressing, which just gives a little more support. Either one of these is fine. And again, now you're going to put on a nice, fresh, dry pair of socks and keep an eye on this. You might have to change this dressing each time you stop for a break and change socks. Certainly inspect it. If it's holding up fine, leave it alone. If it's getting wet or wrinkling, you want to change it.